please begin.
Okay, good morning, Chairman Watson and members of the Children and Youth Committee. I want to thank you for bringing up House Bill 1436 for consideration today. I was tempted to start by reminding you of Dietrich Bonhoeffer's quote regarding the morality of a society and how it can be measured by what it does for its children, and go into some depth with you about the importance of putting children first in making legislative decisions. But then I remembered that this is a Children and Youth Committee. I would suggest that no one in this building gets it better than the members of this committee. So I'll just move on. As we discussed in the hearing in March and at several individual encounters over the past 3 months and in some email exchanges, House Bill 1436 simply tweaks existing language in state law to guarantee that amino-acid-based elemental formulas will be covered by insurance when a doctor determines that they're medically necessary for children with food-related allergic disorders. The testimony that we heard in March was quite emotional and very compelling. Dean and Cole made it quite clear that no one would choose to drink elemental formulas unless their only alternatives were a feeding tube or life-threatening malnutrition. The parents who testified described having to make gut-wrenching decisions that were complicated by concerns over whether insurance would cover the very expensive treatment. I think it's pretty obvious that insurance should cover these formulas, whether they're consumed orally or by a feeding tube. No parent should have to consider putting their child through an invasive procedure to have a feeding tube installed just so that they would not be bankrupted by the cost of treatment that their child needs to survive. Now, I'm expecting a pretty close to unanimous vote today, but I want to make sure that everybody goes away from here feeling like you did the right thing. So I want to address 4 concerns that have been raised about this legislation and try to put your minds at ease. I believe that all 4 concerns are pretty easily dismissed. The first one is the question has been raised as to whether insurance companies would be required to cover the cost of foods that are commonly available at grocery stores, like gluten-free foods. Now, one of the beauties of House Bill 1436, I don't know if you recall, we actually had 2 different bills, and we decided to go with 1436 because 1436 modifies an existing law. We already require insurance companies to cover the cost of amino acid-based elemental formulas for people with other disorders, including something called PKU. I can't pronounce the words that PKU stands for, but it's another disease that requires its victims to either drink amino acid-based elemental formulas or take them through a feeding tube. So if the current law doesn't require insurance companies to cover the cost of gluten-free foods and other things that are available in the supermarket, this modification won't change that. All we're doing is adding to the list of disorders these esophageal food allergy-based diseases, so that it won't matter that you have to take this elemental formula because you have this disease, it's covered, but if you have that disease, it's not covered. It doesn't make sense. If you ask me, I wasn't here when the original legislation was passed. I don't think the intent was to narrow it down to just certain diseases. So I think it's pretty reasonable to add the food allergy disorders to the list, and I don't believe that it will create any new requirements for insurance companies to cover things that people can get at grocery stores. If that potential is there, I'm certainly open to working with representatives from the insurance industry to find language that we can amend in on the House floor to tighten that up. I really don't think it's necessary, and frankly, I'm not going to negotiate with myself, so unless they put an offer on the table of some specific language they'd like to see amended into the bill, I think we move on with the language as it is. Another argument that's been brought up is they say that, requiring insurance companies to cover something that they don't cover increases costs, and this is a cost that's going to be passed on to policyholders. And indeed, we are expanding the scope of coverage, but we're not increasing or decreasing costs. A lot of the problems that we have when we talk about health insurance in the United States, either as a national debate or a statewide debate, is we're arguing about who's paying the bill. We never talk about how to increase or decrease the costs. And indeed, in this case, we're not changing the costs. We're just shifting who's likely to pay the bill. The total increase in cost, if there is one, is on the order of pennies, less than $1 per policyholder is our anticipation, because there are fewer than 450 families in the entire state who are affected. So if there's 203 House members, you can expect that you probably have 2 or 3 children in your district who are affected by this. I happen to know all 3 of them in my district. So the cost is trivial, and all we're doing is shifting it from either the family or the Commonwealth to the insurance companies. One way or another, somebody's going to pay that bill. In very few cases, it's going to end up being the family. If the family has to cover it initially, it doesn't take long before these costs bankrupt them, and now they're on Medicaid, and the Commonwealth is picking up the cost anyway. A third concern that's been raised about this is whether putting in a mandate that goes beyond what's required by the Affordable Care Act will put the Commonwealth on the hook for paying the bill. In other words, the way the Affordable Care Act is written, if the state requires some coverage that goes beyond what's recovered by the Affordable Care Act, then the state has to pay the bill. I'm going to go back to the last point that I just made. We're already paying the bill in most cases through Medicaid, so we're not making a big difference there. We also already have a law requiring insurance companies to cover these amino acid-based formulas. We're just expanding the list of the diseases for which it has to be covered. So I really don't think there's any increased cost to the Commonwealth. If anything, it should be a decreased cost to the Commonwealth that'll be picked up by insurance companies and spread over its policyholders. Finally, just in the last category, and you guys know based on conversations, I'm a pretty conservative guy. I'm a free market thinker, and I understand completely the concept that mandates are bad. And in a truly free market, I would agree. But unfortunately, insurance markets are restricted, and without the ability to buy insurance across state lines, we really don't have that many choices. I'm going to tell a brief story here to illustrate my point. Many years ago, I purchased an extended warranty on a car. They said, this is a bumper-to-bumper warranty. I thought, that's a great thing. That way I know what my costs are going to be, and I paid extra money for this warranty. A couple of years later, my driver's side window stopped going up and down. When I pushed the switch, nothing would happen. So I took it in and they repaired it, and when I went to pick it up, they said that'll be $9 or whatever it was. And I said, I thought I had a bumper-to-bumper warranty, and they said, oh no, the problem was the bracket holding the switch in place, and that bracket isn't on the list of parts that's covered by your bumper-to-bumper warranty. I said, well, that's ridiculous. When I bought the policy, I never would have thought to ask, is the bracket that holds my window controls included on the list? It's silly. And if you're an individual buying a health care policy, the last thing you're going to ask the insurance companies, if you don't already have somebody in your family who's affected by one of these disorders, you're not thinking, oh, by the way, does this medical insurance policy, does it cover elemental formulas if my son or daughter has an esophageal disorder or a food-related disorder that requires them to consume that? You just don't know that. Insurance should cover everything except those things that it excludes. But in this case, we have insurance companies finding an excuse saying, oh, we would cover it, but you're taking it orally and not through a feeding tube. Or we would cover it, but you can also eat cantaloupe and maybe one other thing. So we're not going to cover it. I don't think, I find it unconscionable that they look for excuses not to cover something that any reasonable person would think would be covered by their policy. So I don't believe that what we're doing here is, we are barely expanding the scope of what has to be covered by these insurance policies, and we're expanding it in a way that I think any reasonable person would think is something that insurance should already be covering. So in conclusion, I just want to thank the many members of the committee who have reached out to me and expressed their enthusiastic support for this legislation, and thank all of the members for their thoughtful consideration, and I hope that you can all feel comfortable voting yes today. Thank you.